Hi, I'm Dr.Sukhpreet Kaur, working as a consultant pediatrician and neonatologist at Cloudnine Hospital, Ludhiana. First of all, we have to see that in the cases of bronchial asthma, if the patient is well known for that and already is on the management and there is a sudden coughing while sleeping, so action plan should be given to the parents that what to do if it is happening at home. There should be an understanding to the parents that what to do if it is urgent or severe and they have to rush to the hospital. So they should be identifying those urgent points, whether it is there or not. So what are those urgent points? First of all, if the baby is less than 1 year and the repeated doses of bronchodilators is needed, so that is an urgency. And secondly, if the relief period is getting progressively shorter, with each bronchodilator dose, and that is also an urgency. Along with that, if the baby is not improving, so that is also an urgency to take the baby to the medical attention. So what we can do at home, first of all, if it is happening at home, so 2 puffs of the Saba has to be taken, in such cases 200 micrograms, and if it is not improved, then it can be repeated 2 times and at a 20 minutes interval. So in such cases, if the improvement is not there in the 24 hours and if more than 6 puffs are required in within 6 hours, then the baby should be taken to the hospital for the further management. In such cases, the second thing can be done that inhaled corticosteroids can be given, and if the parents are well understood the thing, and if there is the upper respiratory tract infection history is there, so leukotriene receptor attack can also be given in such cases. So in cases of less than 5 years or younger babies, if there is an requirement for taking the medical attention, so in an emergency department, first of all we have to certify that whether the child is in mild to moderate cases or the severe cases. If the child is in the severe cases, that absent of breath sounds are there and saturation is going less than 92% and there is a tachycardia is there more than 180 in the up to 3 years and more than 150 in 5 years, then we have to go for the direct ICU management, and the Saba can be given along with the ipratropium and the corticosteroids and can also be given in such cases. And if it is in the mild to moderate category, so first of all in the triage only, then we have to go for the Saba and the ipratropium, and if improvement is there, we can start with the oral corticosteroids also. And there is no improvement is there, so we can go for the ICU management. And if initial improvement is there and after that there is again the reappearance of the symptoms, we can again go for 2 to 3 puffs of Saba, and along with that prednisolone can also be given. Again, if there is worsening, then we have to go for the ICU management. If improving, then we have to go for the discharge and follow-up planning. So in babies older than 5 years of age, first of all we have to assess the airway, breathing and circulation, and if there is altered consciousness, drowsiness or confusion is there or absent chest is there, directly ICU management should be there. And in other cases we have to go for the categorization of into mild to moderate and the severe cases. And we can manage these cases both the cases on the Saba and along with that ipratropium and oral corticosteroids, and in the severe cases we can go for IV Mexaf and along with that IV corticosteroids. If improvement is there, then we can go for the discharge and follow-up, and if it is not there and it is worsening, so we can go for the ICU management in such cases.